After 3 decades of research, the time has arrived for Brain Brilliance. You can be the first doctor in your community to offer our nutritional formulas that are designed to enhance the health of the nervous system tissues. Years of research and the application of various nutritional programs caring for a patient population have produced amazing clinical outcomes. The Brain Brilliance family of micro-synergistic nutraceutical products targets disconnect brain and central nervous system disorders such as Alzheimer's, dementia, ADHD, and brain injuries. Brain Brilliance represents several extremely avant-garde, cutting-edge, and therapeutically important nutraceutical products that are essential to effectively support the brain, central, and peripheral nervous system cellular and its tissues' health. There are no pharmaceuticals on the market today that promise a cure for any disconnect brain and central nervous system disorders. 3 Brain Brilliance nutraceutical products have already launched: Brain Bright Enhancement, Brain Bright Detox, and Brain Bright Night. Each has its own unique formulation. You won't be able to purchase these in stores. Instead, patients will have to go to an authorized Brain Brilliance doctor who will follow a strict protocol in the administration of the Brain Brilliance products. The protocol will involve preventative and therapeutic programs outlined in detail by Brain Brilliance Incorporated. The protocols parallel years of research that have proven effective. Only physicians who are educated in the proper use of Brain Brilliance products and follow the outlined protocols will be allowed to distribute Brain Brilliance. Physicians that offer Brain Brilliance products distinguish themselves uniquely in their community and develop a practice within a practice that will assure the highest standards of patient care will be accomplished. Ethan was 4 when he started the Brain Brilliance program with Dr. Michael Whitman. He was diagnosed with autism soon after birth. He was nonverbal, didn't talk, he was non-social, and wouldn't make eye contact with anyone. Dr. Whitman found he had food sensitivities to wheat and dairy, and he was on a very limited diet. Whitman also found heavy metal toxicity and toxic chemicals affecting Ethan. He started him on a program that included nutritional liquid supplements and a spray metal detoxifiant, along with his special chiropractic adjustments. Approximately 6 to 8 weeks later, a miracle. A whole new boy started to emerge. He started jabbering and chatting like crazy. It was like he was discovering people and things for the very first time. Now, he's started kindergarten with the other kids. He still has challenges and he's a little slower than some of the other children, but he's still a whole new boy. Harvey Edwards of Indiana is another success story. Suffering from memory loss, Edwards began the Brain Brilliance regimen under the supervision of Dr. Adrian Hagedorn. Here's what he had to say.
When I started care, I was really in dire straits. My memory was terrible, and I've always prided myself on my excellent memory. But my memory had become so bad, I truly thought I wouldn't be able to keep up my business. Well, after Brain Brilliance, all that has changed. My memory is back. I really think I'm better than I was before. People are always remarking on it. I can also handle stress so much better. Just the other day, I tried to remember the name and phone number of a person I had not talked to in 10 years, and bang, there it was. I'm like a new person, physically and mentally.
Cheryl's daughter, Michaela, also benefited from Brain Brilliance. Not able to focus in school, Michaela began the Brain Brilliance protocol under the supervision of Dr. Michael Whitman.
She knows what she's supposed to do. She knows her regimen. But since we started taking them, her focus has become better. She has actually improved in her grades. In fact, today she got a 94% on her phonics test. It's just been a very good experience for us.
At this time, I would like to introduce my friend and colleague, the wonderful, talented Dr. Mike Whitman.
The last 10 years, the amount of ADD, ADHD has just exploded. Unreal. Our procedures are very specific, our specific testing procedures and treatment and so forth. My thoughts were this: if we could develop a program that was duplicatable, simple, could plug right into any practice and help the majority of these disconnect syndromes, ADD, ADHD, depression, sleep disorders, memory disorders, chronic pain, then it would be a godsend to the chiropractic profession and many others. And so basically, we worked on developing this procedure. They've been tested in my practice with me and my associate, Dr. Adrian Hagedorn, and we have had dramatic dramatic success with it. So we know it works, and that's extraordinarily important. So basically, what we're going to do now is I'm going to explain to you the protocols and the products. The products are extraordinarily unique in that two of the products initially are sprays, oral sprays. Why oral sprays? We had so many children that they won't take pills. The sprays are simple, they taste good, and they're extraordinarily effective. We have a powder, a whey powder, purest grass-fed organic powder on the market. And so basically what the Brain Bright program is, it's a duplicatable, consistently successful, plug-in program that you can start the next day. So now what I want to do is I want to go over these products and how you use them. We see patients once a week for 6 weeks, then usually once every other week for 12 weeks. Many of them then will come once a month for 6 months. And we're able to use our procedures, our chiropractic procedures, various acupuncture procedures in some cases, and the supplementation and diet modification to successfully treat these type of conditions. There are 3 primary ways you can evaluate your patients to see if they would benefit from the Brain Bright program. If you are a Corinne-specific practitioner, basically you can use these points and use your occipital drop as the evaluator. This is from the work of Scott Monk, DC. This is functional bioanalysis points. This point here is called conception vessel 24. If this point is positive, by positive it would be you have the patient take their finger, touch the point, and if you get an occipital drop, it's a positive finding, which indicates this particular person has low dopamine utilization or production. The next point you would check is up here, bladder 1. And if the patient touches the point and you get a positive occipital drop, that indicates low serotonin levels. The Brain Bright program, the sprays, both the enhanced, the detox, and the powder, Brain Bright Night, treats those things very effectively, along with our diet modification and your chiropractic treatment to balance the central nervous system. So basically, the patient touches the point, you check. The patient touches these points, you check. A positive finding would indicate the need for the Brain Bright program. Now, go ahead and lay back here if you would, Adrian. Basically, if we're doing kinesiology, you can use any of your forms of muscle testing. If you're going to use basically deltoid testing, you would do the same procedure. You would see CV24. If the patient goes weak, that's a positive findings. Bladder 1, the patient goes weak, that's a positive findings. I personally use a procedure called O-ring testing, where the thumb and little finger are pressed, and we go to these points, and it is positive. And we go to bladder 1, and that's negative, but CV24 was positive, indicating a weak muscle. So that would indicate the need for the Brain Bright program. And basically, the other methods and means that you can use is doing a clinical evaluation, a 6-week study on the patient using our protocols, the Brain Bright protocols, and usually our clinical experience has shown 92% of the patients will respond positively within a 6-week span. And so basically you can do just a clinical evaluation by giving the protocol of the Brain Bright Enhanced, Brain Bright Detox, and Brain Bright Night with the absolutely necessary diet modification and the chiropractic adjustment. 50% of all ADDs do not have the hyperactive component to them, along with anxiety, depression, and so forth. In just this last 10 years, the amount of these conditions have exploded. And how are they treated? They're treated with an amphetamine-based drug, Ritalin, for instance, Adderall. And basically, what does that do? It causes all kinds of changes in the body. It causes blood sugar handling problems. It causes changes in the brain. It doesn't repair the brain. It literally distorts brain function. It creates an addictive personality in the patients that take this repetitively. So you can see the dramatic effect on society when we have so many children and adults taking these pharmaceuticals because they don't know there's an alternative, a safe, effective, healthy alternative. And so let's talk about the alternative and the absolutely essential component of balancing the central nervous system, the chiropractic adjustment. What about the diet program? This is our diet book. And what does it base on? Now remember I said in my practice for the last 3 decades we do very specific diet testing, food testing. Well, not everybody does that. And there's all those people going without care all over this country. So we have taken the most inflammatory based foods that affects the central nervous system and told you how to eliminate them. What is the first one? It's gluten. There's a book called Brain, and basically Dr. Piermuller, who is a neurologist from Florida, wrote this book, and it outlines the dramatic effects that gluten has on the inflammatory process in the central nervous system. Gluten. A lot of people will need to restrict sugar. If you have an inflammatory symptom complex like disconnect syndrome, you better limit your sugar intake, big time. And it goes through and it explains all the products that has these things in it. Okay, omega-6s in this society, in America, grossly outweigh the omega-3s. Thus, the epidemic of inflammatory diseases, heart disease, cancer, diabetes, dementia, Alzheimer's. You have to balance those omega fatty acids. It's essential, not only for disconnect syndromes, but for your overall health. You're going to have a percentage of parents that's looking for an alternative to that drug. But you have this rather substantial group of people that's looking for an answer, an alternative. And that's what this is. That's why the compliance is so good. The research now shows that this generation of children will be the first generation not to live as long in years as their parents. Look at the prestigious concept as a doctor you will take on with a consistently successful program like this. I thank you.
Hi, my name is Faith Edwards, and I've been a patient of Dr. Whitman and Dr. Adrian for 10 months now, and my only regret is that I didn't call them 10 years ago. This time last year I was a very different person. I was very sick. I had been diagnosed with several different incurable diseases. I was in chronic debilitating pain. I had lost my job. I had applied for permanent disability. I had no hope really of ever getting better. I was on 12 different prescription medications every day, and that's what we got it narrowed down to basically. I was in a doctor's office of some sort at least twice a month getting experimental treatments and anything else we could think of, surgery after surgery, to try to have somewhat of a normal life. And so I decided to call Dr. Whitman, and he just started doing a normal checkup, and it kind of caught my attention. And then we went and sat down in his office, and he said, you know, you have inflammation all over your body, which is what all the other medical professionals had told me. Then he said, we're going to figure out why, and we're going to figure out how to fix it. After just 2 treatments, I started feeling better. And then after a month, I started to think, you know what, this guy really knows what he's doing, and I really am getting better. After about 3 months, I thought, I'm better. I'm great. I'm back to myself. I'm better than I've felt in 6 or 7 years. It's just an amazing difference, and I'm so thankful.